Well, good evening, and thank you for tuning in to Fathers Who Care. It is indeed another pleasure to be back with you all. Last week, we wasn't here because of the DNC. And so tell me when you get a chance, what did you think about the convention? Actually, I'm going to pose that question to you when we get a chance.
Okay.
What do you think about the DNC? I personally had a chance to view it a couple of nights. And I thought it was rather exciting, to be honest with you.
You could tell the energy and intensity was really, really special.
Yeah, I thought folks were really excited about it.
Mm-hmm.
I felt the energy. I saw the energy. I saw folks' faces. It looked like there was so much joy. But anyway, again, you're watching Fathers Who Care, and I would be your host this evening, Walter Jones, the Executive Director of Fathers Who Care. And this show, we're going to bring to you some information with individuals who are committed to empowering our community, who has committed to doing the good work to try to empower the least of us, and then who's truly compassionate about what we're doing and why we're doing it. You're watching Fathers Who Care, Channel 21, CAN TV. Thank you, CAN TV, for all you do for so many years and for being that conduit, if you will, for allowing individuals and agencies to come on to share information and to do what we can to empower those who are less fortunate. It's extremely important that if you're looking for volunteer opportunities, if you're looking for places to bring young people between the ages, we have two cohorts, between the ages of 13 to 17 and 18 to 24, give us a call at Fathers Who Care. We're gearing up another internship program. We're gearing up some after-school programming for young people, and we're also trying to make sure that we provide that peer leadership for young people to have their own forum where they can come together, do their TV shows, come together and do their weekly empowerment groups, their leadership groups, come together and share with each other some of life skills, some of the decision-making techniques, and whatever young people need to know. We want to make sure that we provide them with a safe environment for them to do just that. So if you're looking for additional information about Fathers Who Care, please log on to fatherswhocare.org. fatherswhocare.org. If you're interested in some of the activities that we're going to be providing this fall, particularly for the young people and for the community, give us a call at 773-287-5821. Again, that number is 773-287-5821. Well, I'm going to introduce to some and present to others my friend, who anytime that I call on her, she does not ever say, I'll get back with you, and I need to get better at that. And she doesn't ever say she can't do it. I think she's just been sent by God to be a support system for me and to help me in some of the efforts that I'm doing on this greater west side of Chicago, because she has stepped in to do the work that, we just asked her once time, Dr. Sorrell, we need you. We need help on addressing these concerns, those concerns. And she came in and she's making it happen. And we have some beautiful meetings, community leadership meetings every first Wednesday of the month at 12 o'clock. And if you're interested in that, give us a call at Fathers Who Care. And we bring all sector partners together, and we talk about various different issues of how we can collaborate and really improve the quality of life on the west side of Chicago. So without any further ado, I want to just share with you, those who are watching, that there is room at the table for you. We know that some of you all, we were just talking about it, Dr. Sorrell and I, about what are you doing with your time? I was just in a meeting 2 days ago. We were talking with the Big Brothers, Big Sisters, and we were talking about mentoring. And I think I've been mentoring now for more years than I can remember. And they was talking to some younger folks, right? And it appeared that they was new, because you feel the energy, right? But then when it was time to try to recruit mentors, they were really kind of trying to figure that out. Now they were cool on 101,
right,
but now that you're in the community and you're trying to grab folks who are busy, all right, folks who are out here, not that we wouldn't do it, it's just that we may not put in as many hours as someone who have more time to do it. We may give you 3-4 hours a month, all right, which is a lot.
And recognizing each time, what may be important is each time you reach out, no matter how long or how much time you have, you can still make a difference in that person's life.
Absolutely. Because they were talking specifically about moving some of their initiatives to the the West and South Side. So
Okay.
in my mind, it was a code word, code words for people of color. And so you can't, when you're dealing with these folks, it's I believe, you really have to bring it, you have to bring realness to them. You have to be trustworthy. You have to be non-judgmental, but you gotta be consistent
Right.
because young people really want the help. But they just don't want to be bothered with someone who they feel are not really concerned about them. So with that being said, let's do this right quick so we can get it moving because it looks like we're going to have a beautiful show tonight. Listen, presented to some and introducing to others, none other than Dr. Tanya Sorrell. And Tanya is going to give us an update. I really think she's extremely modest, and I think she's really committed to the people. I know she loves the people, and trust me, she shares information. Every time she shares it, it's always about empowering folks. So we kind of gave her the title as chair of our health and wellness committee because every time we talk to her about something, she's always up to date. And if she's not up to date, she's going to get it. And it doesn't take long for her to get it because when we're ready to roll, it's there. So Dr. Sorrell, we want to thank you so very much for all that you do. We want to thank you for your compassion. And we also want to put out, if you don't mind, a public service announcement tonight.
Okay.
And that public service announcement is that if any of the young ladies or women that are watching that are part of the AKA sorority, correct? If they're interested in a good member,
Okay. It's time, yeah, and getting back in the fold.
she's
you
getting
know?
back in the fold. Now, she just said to you, it ain't how much time you give, it's what kind of time you give.
and quality.
And the quality of time. So I'm saying to you now, we're in that mood, in that spirit, where we're trying to let folks know that there's always a place for all of us. But most importantly, those who know better do better. And I think the best thing that we can ever do is share our life experiences with someone who's less fortunate.
Exactly.
But go
That's-
ahead, please.
But, and let me, if it's okay, to
Please,
introduce
by all means.
myself
Thank
a little
you.
bit so that you can really see how I've become a part not only of the Chicago community, but every community within Chicago that has needs, that has care and questions and concerns. My name's Tanya Sorrell. I'm a psychiatric nurse practitioner and an associate professor at Rush University Medical Center. I'm actually also the director of Rush's Substance Use Disorder Center of Excellence, which is really focused on community education, knowledge in substance use issues, overdose prevention, and Narcan and harm reduction distribution in the community. We know that our communities are experiencing higher levels since COVID of substance use, from the stress of life, from the ongoing traumas that we encounter, from sadly prejudice and racial issues, from environmental issues that make it harder to be able to go out, to exercise, to get a job, to do the things that we need to do, or what we in academia may call our social determinants of health. But right now, Rush has a sign on the building if you drive by, and it says, "Who has the chance to be healthy?" Truly, everyone should have a chance to be healthy.
I like that.
But we know that sadly, there are disparities, and those disparities have nothing to do with the person. They have to do with their environment, their situation, perhaps their neighborhood. And that's one of the reasons that I came to Rush, to be a part of that work in addressing those health inequities, those disparities, and reaching out to particularly communities of color to provide that access to care, services, and helping them to know that everyone should have the chance to be healthy and that we're all working to make that happen.
Okay. And you know, I think you're extremely a breath of fresh air. I mean, because you know how sometimes we all get, you know, those of us in the circles really are not as big as people think. You know, we're basically a group of folks who've been around each other, who's been working together. And you see some of these same folks in all that we do. So we're good at supporting each other, empowering each other, and being there for each other. But the circle is really not as big as one may think. It's room for many to come out and join, just as you have been hearing from others over and over and over. If it is to be, it must begin with me. So that means that it's room for you. But Dr. Sorrell, let's talk. Let's just talk seriously for a second. Some people do things because it's their job. Some people do things because they are passionate about it. Some people do things because they know they've been called to do it. Right? What is your what why are you so driven, and what motivates you to do what you do?
You know, I've mentioned this, but I'm from Louisiana.
No.
So yes, I'm from Louisiana. This is jambalaya season right now. So
Okay.
if you shrimp, sausage, rice, we're
works.
good. We're ready.
Yeah.
We're ready. But
We're
in
ready.
Louisiana, we saw those disparities firsthand in our face. Not just those disparities of environment, but the disparities of prejudice and racism. When I was growing up in middle school, they closed the swimming pool in the city park rather than integrate that pool. I was one of the first groups that was integrated in school. Prior to middle school, you went to a school that was all black, all white, no integration.
No integration.
And the integration started with moving my mom, who was a teacher, a fourth grade teacher, out to a white school. But she said, if I'm driving out there, my daughter's coming with me. So from the early time, I saw these disparities. Speaking of the calling part, when I was younger, my grandmother said, you're going to learn lots of languages, you're going to travel around the world and help people. So she spoke that to me, and being from a family that says, yes, you are part of that community and doing, I've always had that, known that that's a calling too. In behavioral health is when I saw the stress and trauma of the things that people suffered from day to day. Loneliness, depression, anxiety, and how that may lead to depression, substance use, or sadly suicide. And we recognize now that that trauma now extends to what we might see as violence. Because if I don't care about myself and I feel empty, then I may look at you that same way. And so that's how the violent perpetuation may start, by feeling I don't love myself. How do I feel in terms of love for you? So all of those motivate me to say, what can I do? What part can I play in making a difference?
And so, but the question initially was, who had that you saw, who has the chance to be healthy, right?
Right.
So you're saying all of us.
All of us should have the chance to be healthy. Right now, all of us may not have that chance to be healthy.
And
that's why health equity initiatives, diversity, equity, and inclusion initiatives, and we know sometimes you may hear other narratives in media say, oh, that isn't working right, or DEI means didn't earn it. No, DEI for most people of color means they darn earned it, because we know that we've always had to work 200% to get 100% credit. And then being able to share and show how we can provide equal opportunities for everybody at the table, as you said, to be able to be at the table and to be able to get healthy in the healthcare fields and interactions, in employment and socialization fields, to be able to have that equity across all systems in housing and healthcare helps people to move towards that actual equity that we want and that we want to work for.
So I want to use the show this evening. I talk with you a lot. I mean, we meet every month, and sometimes twice a month we do different things, the leadership, the executive, in the community. So we're always talking.
Sure.
So we're always exchanging resources, information, and empowering each other. I mean, it's impossible for us not to, because we're in that circle. But so often we are engaging through this medium a great many individuals who just don't feel comfortable addressing some of their psychological, emotional concerns with others.
Right.
Unfortunately, there seems to be some stigma that we all are facing, knowingly and unknowingly, that it's not cool to get help. Would you please help us to dispel that myth?
And it's such a ingrained stigma, not only for our community, but many communities of color. One, part of it starts from the structural history and issues.
Okay.
If you looked like you were weak, you'd be the one that was getting picked on. So you had to try to put on a face and say, no, everything's okay, or hush or quell emotions, shush emotions, and not express emotions when you had them, because you didn't want to look like you were weak or potentially vulnerable in a society that may not have always had your best interests. But now we recognize that holding all of that in, the pressure, the stress, not being able to speak or communicate with other people about it, that actually continues to cause problems, anxieties, potential issues for you, physically and mentally.
Okay.
And so being able to feel comfortable saying, and I'm going to use your phrase, being able to say when you're not okay, and to say it's okay to not be okay, and to
But it
feel
is.
comfortable sharing that with others.
But it is okay.
It is.
So
And it should be.
how can we get people to understand that? And let's go with that by giving just an overview, if you will. You're going to tell us more about self-care. I mean,
Okay.
clinically speaking.
Right.
We're going to talk about self-care. We're not just going to throw it out there, a term, self-care, because some folks think self-care
that?
is just,
I took a bath, I brushed
yeah,
my teeth.
yeah.
I took care of myself.
Yeah, I'm playing some music, all right? I mean, that might be good for some folks, the time that you take to do it and the time you use to meditate or whatever you might be doing.
If that's part of it.
If that's part of it. If that's part of it.
Right.
But you're going to give us some insight on what is really self-care and why it is important.
Okay.
And what I'm really trying to get our people to understand, as we have been talking to folks who have been the recipients of the Stronger Together initiative, where the county has been putting resources out in the community, and thank you for doing that. We just want to make sure that they get in the community. Okay?
Exactly.
And we want folks to make sure that it reach those who need it most.
Right.
And that those resources are available to folks who may not have the resources to access that kind of care.
Right.
But talk to us and tell us, what in your opinion, what is the state of mental health in the city of Chicago, and what can we as community elders, leaders do to empower folks to understand that it's okay to seek out?
You know, those are great questions. I'm going to take them a little bit at a time.
Please take your time.
Currently, what's happening in the city of Chicago is that we realize that some of the decisions that we made in the past, like closing mental health centers, condensing or having mental health centers only in some of the academic, like the Illinois Medical District, or way down in South over at U of Chicago, may have actually made it harder for people to access care. If you live way up in the north, if you live in the west suburbs, how do you get help? And so what Cook County looked at doing is saying, hey, we need to have dollars that are invested not only in behavioral health, but our behavioral health at the community level. Okay? Because for most people, how long does it take to get to Illinois Medical District? You have to take a bus to get to the blue line, get the blue line, then walk and hope the blue line is working and it's not, stopped for an accident or something.
Right.
And all of those cause difficulties with people to be able to access care. We recognize that now having telemedicine available means that literally you can use your phone and go to a betterhelp.com or Rush. Myself, I do psychiatric services by telemed. So someone literally can open up their phone and talk to me one-on-one by phone, just like we're talking right now. So we're trying to make care easier to access and letting people know that it's okay, because not only are we working to address things from a culturally appropriate level, because if I just say, oh, I have this issue, but if the therapist or the person working with me doesn't recognize that depression doesn't happen in a vacuum. It has the relational issues in the home. It has the environmental issues. If you're not able to go outside, you're in a high crime area where you're hearing gunshots or hearing the shot spotter or hearing sirens. All of those impact your health. So we actually train in cultural competent care so that providers have a better understanding to truly be able to meet you where you're at. And all of the areas in a more, what we call a holistic approach, all of the things and aspects that make up you to be able to provide the health that you need.
And you mentioned another one, 988.
Okay.
I mean, I would like to believe that after all of the work that we have been doing with the city and other departments, that, and this was before the 988 came about, all right?
Okay.
And we used to stress these concerns and not only in our leadership meetings, but the actual community meetings where folks were actually coming out
Okay.
prior to COVID,
Sure.
and then the relationships that we had with those folks,
Okay.
which. And I think, the city of Chicago, I really believe, is good at providing what is needed if you can justify the need. Right?
Right.
And so there's always been a correlation between substance abuse, violence, with mental health.
Yes.
And I think it would always be. So how do we transition folks into understanding that help is available, but all you have to do is just
Call.
make the call?
You were probably then one of the leaders, but there were people in every state recognizing that access to care, access to behavioral health care was very limited. And sadly, when you didn't get access to care, people got worse. And then all of a sudden they were having a behavioral health crisis. And then who do you call when there's a crisis? Unfortunately, the only number that was available was 911.
Right.
And unfortunately, the police aren't trained in doing crisis therapy, crisis de-escalation. And that's why we were seeing over and over again, someone was calling, a family member, a loved one was saying, come and help my brother, come and help my loved one. The police, unfortunately, were coming, and in less than 2 minutes, that person would be shot. 55% of police calls from 2018 to 2020, when they were saying we need to institute 988, 55% were people who had called 911 for a mental health crisis.
Right.
That's when the entire nation said,
Enough is enough.
Enough is enough.
Yeah.
And so 988 was developed nationally and then implemented on each state, from each state basis, to say, what is a line that we can call to reach out for help and mental health that won't necessarily result in the police responding, who don't have the capacity or the means or the knowledge to be able to truly respond to a mental health situation, and how can people then reach out? Because families were saying, well, I'm not going to call 911 because cousin's going to get killed. And sadly, they had a legitimate beef that could be the case. But having 988 to call gave them someone, a trained counselor, a trained crisis provider, to be able to say, what's going on, where are you right now, and how can we help?
So now you heard why we need to talk about mental health intervention and support, mental and behavior health intervention and support.
Right.
Why it's important for you to seek it out, and we want to make it hip. Right? We really want to make it hip to say, listen, Dr. Sorrell or Tanya, haven't been feeling my best lately, and I've been experiencing some poor choices.
Okay.
I have not been sleeping like I should, eating like I should, socializing like I should, fellowshipping, whatever it might be.
Right.
I've been off keel. All right. What's wrong? What do I need to do? I need to practice. I need to focus more on my self-care, and why is it important? So tell us, what is self-care, and what can we do to manage it? And take us to the next level and tell us what are signs of not taking care or not. But not taking care of yourself.
Exactly. And I think, sadly, when we have that stigma, we have it about saying that we're not doing well, and we have that about reaching out to get help. So we tend to kind of bury it, like we said, push it back, and we tend to try to overcompensate. Well, I'm going to work harder. Well, working harder may mean then you start to feel more tired. All of a sudden, you've had a heavy day, you've had a 12-hour shift, you should come home and be able to fall asleep fine, and you can't fall asleep. It's 2 a.m. and you're still looking at the TV or doom scrolling on your phone because you can't fall asleep. Feeling like even during the day, when you've had some sleep, that you still don't have the energy to get done what you need to get done. Starting to be irritable with people, where people say, ooh, what's wrong with you? I just said, such and such, and you bit my head off. Or seeing that you become isolated, just like you said. Hey, man, we're having a cookout. Come to the cookout. Oh, no, never mind. You start to kind of back away and isolate from other people. And then even having thoughts of death. What's the point? Is life worth living? Those are the signs, first off, that you're not providing the care that you need for yourself, and that it's important at that time to be able to reach out for help. self-care then means having that space to feel, to experience what you're experiencing, to talk with yourself about how are you feeling from day-to-day life, and to be able to take the time through meditation, prayer, like you said, a nice bath with herbs or eucalyptus to kind of help to say, I'm present in myself. I'm grounded and feel like I know where things are and know how to be able to move forward. And that actually empowers you and strengthens you to be able to say, I want to feel grounded and feel like I'm myself, my real self. And then to be able to reach out if needed to get help and to get that additional assistance if you're having trouble coping.
Listen, I know we've said a lot. I know we've shared a lot, but we're going to do another one. We're going to do a part 2 because we were concerned about some questions that we were talking about, but we knew if we just stayed true to what we needed to stay true to, which was mental and behavioral health and those concerns, that we have adequate. But we got some things coming up we want you to be involved in. For one, we got the Congressman's annual picnic parade and caravan on Saturday, starting at Bloomingdale at 8 o'clock, going to Columbus Park. Then tomorrow we have the International Opioid Awareness Day.
Awareness Day for the West Side Heroin Opioid Task Force.
And that's tomorrow from?
Right. From
I think it's 11 to 1.
11 to 1. And they're at the Catholic Charities Peace.
The old ABC Bank.
Oh,
right on Parkside and Lake Street.
I'm new to Chicago. I'm learning Chicago.
Yeah, the
still.
old ABC Bank.
Right.
Right at Parkside and Lake Street. It's the Catholic Charities new building now, for those who didn't know. But anyway, then we have on Saturday, we also have the Near South Side, right?
The South Side Rosk.
And that's from 12 to 3 at 329 West 18th Street.
Right.
And then we got the South Side Task Force, who's going to be doing something at the county, 2650 South California. Give us some closing comments as we close out, Dr. Sorrell.
Thank you, Rev. Anytime you ask, you're right. I'll be right here. And we're always here to be able to talk with you. September is Self-Care Awareness Month. So every day, start off your day feeling, deep breath, knowing that God is with you. We're with you. When you reach out, there's someone there to be able to help and answer. And start there, and your day will work as it should.
Listen, so we thank you all so very much for your patience and your time. And we hope that you got something out of this exchange of information. And please get in touch with us at your earliest convenience for additional information, 773-287-5821. Fathers Who Care. God bless you. Good night and keep the faith. Thank you, Dr. Sorrell, for all you do.
Thanks, Rev.
You rock.
Thank you, sir. Rush Substance Use is Rush, SUDLC, at rush.edu. We're here, and we're here to help you.
God bless you. Good night, and we'll see you soon.
Bye-bye, guys.